Today's topic, I'm going to be talking about exercise and how to exercise for people with chronic pain. And so again, going to be talking about that. Before I get into it, as people are kind of jumping in, I want to remind you and let you know that I'm going to be doing a free live workshop next week on Tuesday. It's going to be Tuesday, July 26th. It's at 2 p.m. Central Time. And so I'm going to be talking about how to master chronic pain naturally. And so it's a free workshop, and you do have to enroll in order to attend. And so there is a link to enroll in the description of this video. So definitely click that link and sign up. And for those who do attend the workshop live, everyone's going to get a free copy of my chronic pain notebook, which is a resource, a tool for you to start utilizing right away that will help you focus less on your pain and more on your pain management strategies, your pain management routine, and all of your healthy habits so that you can start feeling better faster. And so with that being said, definitely go check that out. There's a link in the description to sign up and save your spot. And so with that being said, today's topic, like I said, is exercise. So I'm going to be talking about how to exercise for people with chronic pain. And so this is in response to a question that I got in the group, in the Facebook group last week. And this is the question: how do you motivate yourself to exercise when the pain doesn't allow you to move most of the time? And so that's the question that I'm going to be answering today. Basically, how do you motivate yourself to exercise when you're in so much pain and you can't move, basically? And so before I really dive into that topic, I want to introduce myself to anyone who's new around here. My name is Alissa Wolfe, and I am a chronic pain specialist, and I'm the founder of the Chronic Pain Breakup Method, which is my 16-week online program that will teach you how to turn down the volume of your pain so that you can live a more active life using science-backed strategies and drills. And so also, I'm actually a doctor of physical therapy, and prior to creating this program, the Chronic Pain Breakup Method, I have actually started multiple pain programs in the past, including one for the U.S. Army. And because I have a background in physical therapy, I'd like to say that I have a pretty good understanding of exercise science, exercise physiology, biomechanics, kinesiology, like those kinds of things. And in fact, any physical therapist can absolutely teach you about exercise and movement. But not just any physical therapist can teach you about exercise for those who have chronic pain. And so, because here's the thing, like giving same kind of advice that you would give to anyone and everyone about exercise, that kind of advice for someone with chronic pain can actually be harmful and can make people worse. And so as a physical therapist who has also specialized in chronic pain, I'm going to be discussing this topic today, because any advice that a general physical therapist or physician or practitioner for that matter has given you about exercise could be wrong. And so we're going to talk about that today. And so I know that you want to work out, right? Like you want to be more active. You want to, you know that it's good for you to exercise. And like you've heard up and down all about the benefits of exercise, right? Like, of course it's good for your health. It can help you get better sleep. It can improve your mood. It can make you stronger. It can help you stay active. It can make you feel more confident in your body, right? Like with your looks. And, whether that's for weight loss or for simply staying at a healthier weight range, right? And you know all of that, and yet you simply can't do it. You can't exercise. You either can't work out because you're already too sore and tired and you can't move, Or you can't work out because you know that it will cause you to go into a 2-week debilitating flare-up, and you have shit to do. So you'd rather be able to do your day-to-day activities than attempt a workout one time for 30 minutes, right? And so if you're here with me live today, or you're watching on the replay, let me know in the comments if that sounds like what you're struggling with, right? Or maybe you don't have the stamina or the strength or the endurance right now, right? Like you can maybe do a couple of reps, but then you're just completely wiped out afterwards and just fatigued. And yet at the same time this is happening for you, all your doctors and everyone, it seems, in the world is just in your ear telling you that you've got to work out. You've got to walk more, you got to go to the gym, you got to exercise, lift weights, do some yoga, swim, or I don't know, like whatever, like get on the treadmill, like whatever, right? And everyone around you is telling you you need to exercise. And you're probably even telling yourself you need to exercise. Maybe you were an athlete or someone who's always pushed themselves, and so you feel this like itch to work out, and it kills you. It kills you that you can't do it. And so also, even for some of you, it may be that exercise or movement may actually make you feel better, but you can't do it because you just hurt so much and you can't move. So let me know in the comments if this sounds like you, if this is something that you're struggling with, okay? And because you're hearing this all the time, you're hearing you need to work out, you need to exercise from all different angles, you start to question yourself and you say, what's wrong with me, right? Like, why am I not motivated? Why am I not motivated enough? And you blame yourself for not being motivated, and then you start to beat yourself up. You tell yourself that you're a loser, you're a failure, you tell yourself that you're weak and you're lazy, and I should be able to exercise, but yet I can't stay motivated enough. And that self-talk makes you feel like crap. And so if that's you, I am so sorry. But it also makes sense to me why you would feel that way, because that feels like shit. Like, believe me, as a perfectionist, as a people pleaser, an achiever with an athlete mindset, I get what it feels like to not feel good enough or motivated enough or strong enough or tough enough, right? And I get what it feels like to not be able to solve my own problem, right? Like, everyone around you and your doctors and your friends and your family keeps saying, well, hey, the answer is right here in front of you. Just exercise. Why don't you just exercise more? What's wrong with you? Just exercise like everybody else and you'll feel better. And so you feel like shit because you can't do it. And so if that's you at all, I need you to hear this. It's not that you're not motivated enough. Motivation is not the problem here. And if you want to know the real problem, there's actually 3 problems, okay? And this is coming from my experience talking with you, talking to people who have chronic pain, and from my experience and training in my profession and my specialty training and working with people with chronic pain for the past 8 years. There are really 3 problems here. Number 1, the first problem is pushing through pain, or pushing so hard that you end up causing flare-ups and more pain and more fatigue, which makes the problem worse. And what I want to say about this is that when we do that, we're reinforcing these pain pathways in our nervous system, and we're making it harder to beat the pain, to tackle the pain problem. And so I want you to look at it this way. When you learn something new, a new skill, for example, let's say you learn to tie your shoes. The first time you start learning to tie your shoes, you're not very good at it and you struggle, right? And over time, with more and more practice, with more and more repetition, you get better at tying your shoes, you get faster at it, your hands just naturally know what to do. It becomes automatic. And in the same way, what's happening is you're practicing those pathways, right? We call it muscle memory or motor memory. And in the same way, those pathways for pain can be practiced and reinforced. And so they get stronger and stronger and stronger. They get better and they get stronger and more rehearsed. And so as those pathways get stronger, they are harder to undo, right? They're going to be harder to it's going to be harder to undo them and make them weaker so that you feel less pain, because they're so much more well rehearsed. And so not only can those pain pathways get stronger, the pain pathways themselves can then get also tied together, wired together in our brains with other pathways, those pathways for movement or exercise or activity. So every time you practice a certain movement, activity, or exercise, the pain also is practiced. And so the brain starts to make this connection between the movement, the exercise, and the pain. And so it naturally knows anytime you do that movement, that exercise, or that activity, it knows to generate the pain. So we have that problem going on as well. And so every time we are pushing ourselves past the point of pain, into flare-ups, into fatigue, we're reinforcing those pathways and those connections. And so this is not good. This is not good for trying to solve the pain problem. As we're continuously pushing through pain, pushing ourselves into pain, we're reinforcing the problem, making it even harder and harder to break up with the pain, so to speak. So what I'll say about this is I don't want you to beat yourself up about this, because this is not your fault, right? Like, this is something that your whole life you've been taught to do. You've been taught to push yourself. You've been taught to not show the pain. Don't show weakness. Don't show signs of weakness. Don't show signs of pain. Just suck it up, walk it off, right? And so this is not your fault, because this is not something that you were taught. Okay, so I don't want you to beat yourself up about this. Okay, the second problem is that your body is not ready for exercise. Okay, what I need to say about this is that pain is one way that our body is able to communicate with us, is able to let us know that, hey, something is going on here. Okay? Pain is more like an alarm than anything else. It lets you know that your brain thinks that there's something wrong, that it doesn't feel safe, or that there's some kind of injury or damage or threat. It's interpreting some sort of danger, whatever that is. And pain is the alarm that it uses to let you know that it's interpreting some sort of danger. It doesn't feel safe. When this is going on, this is a sign that your body is trying to tell you that it needs something else. It needs rest. It needs safety. It needs a chance to heal, whatever. It needs something else. So what we need to do is actually to think of your pain similar to the cry of a scared toddler or an infant. Is it helpful to yell at a crying, scared toddler? Right? To tell them, is it helpful to tell them to suck it up and get back to cleaning their room or doing their chores or something when they're crying and scared and fear? Yelling at a toddler that needs something from you, needs to feel safe, is not going to be helpful, right? Pushing that toddler to just suck it up and move on is not going to be helpful, right? If you do that, what's going to happen is that toddler's just going to cry louder and louder and louder. And that is exactly the same thing that happens as we ignore the pain, we push through the pain, and we don't address what our nervous system is trying to tell us, right? Pain is our body's way of communicating with us and letting us know something needs to change. And so pushing through that and not addressing the nervous system and not changing anything is not going to be helpful. And so this is your body crying out to you that it needs something different, it needs safety, and you're pushing yourself to go to the gym or work out, doing that is only going to make those cries louder and make the pain louder, because your body is not ready for it. Your body is not ready for exercise. And if you do exercise and you make that pain worse, you're doing the opposite for your motivation, because in your brain's pathways, right, you're reinforcing that exercise is not safe. You're reinforcing that exercise is not safe and movement is not safe. You're reinforcing those pathways and those connections between pain nervous system's reactions to movement, modifying your nervous system's reactions to activity or an exercise by retraining your nervous system. And by doing this, you will become more able to be more active, and your tolerance for activity will increase. In your exercise, your tolerance for exercise will slowly but steadily improve. Okay? And that brings me to problem number 3. The third problem is that you're not given any tools or strategies to get you there, to do this kind of thing. We're taught the wrong things, right? Like for me, in PT school, getting my physical therapy doctorate, I was taught that if my patient wasn't getting better, I should just make sure that they're doing more repetitions, right? And if it hurts, that means that it's working and it's effective. And that they need to be more compliant, my patients need to be more compliant with their home exercise routine in order to get better. So they need to do more. And so if that patient came back to me and said, hey, Alissa, I'm not feeling better, I'm actually feeling worse after doing those exercises that you recommended, despite doing, like I did, 3 sets of 10, 3 times a day like you told me, then my response was supposed to be, then do more. It's not enough. Do more. Instead of 3 sets of 10, 3 times a day, make it 3 sets of 15, 4 times a day. It's never enough. You always need to do more. You need to keep pushing yourself. And this is the wrong advice for people with chronic pain, because people with chronic pain have to solve the nervous system problem before they can effectively strengthen or stretch or work out. They need to reduce the sensitivity in their peripheral nerves, the nerves in their body, nerves like the sciatic nerve, for example. They need to rewire the pathways in the whole nervous system as well to make those pathways weaker. They need to change the activity in the brain, what's going on in the brain, and they have to reduce their fight or flight responses as well. And also we need to strengthen the body map inside of the brain, so that the brain doesn't always think that it needs to protect you. And so doing all of those things will help to reduce your body's reaction to movement and exercise enough so that your body is ready to move again, is ready to exercise again. And so I'll say this too. You know how everyone always talks about how exercise causes you to release endorphins, which will improve your mood, right? And make you feel better. Well, if you have pain during and after every exercise or every time you exercise, you're not going to get that endorphin release. And in fact, instead of positively reinforcing the act of working out with positive chemicals, those endorphins act as a reward chemical. If instead of that, what you're instead of feeling joy and happiness and like euphoria because of that release of those endorphins, instead of that, you're feeling worse. You're feeling more pain and more fatigued. That's actually acting more as a punishment for working out rather than a reward. It's going to work against your ability to feel motivated. And so if you want to know how to get motivated to exercise more when you have chronic pain, you need to solve the pain problem. Again, if you want to know how to get motivated to exercise more, you need to solve the pain problem first. You need to give your nervous system a chance to recover, to calm down, and to retrain the synapses and activity in your brain and spinal cord and body. That's what we need. That's what we need to be doing instead of pushing our bodies to exercise more. So to answer to the original question, how do you stay motivated to exercise when everything hurts and you can barely move? The problem is not motivation, right? The problem is not motivation. There are 3 problems here. 1, pushing through pain makes pain pathways stronger. 2, your body is not ready for exercise and you need to calm that system down, your nervous system down, before you can effectively exercise. And 3, you're not taught how to do that. You're not given any tools or strategies in how to calm things down to make your body ready for exercise. And so with that being said, I am totally sure, I'm confident that you want to know how to solve this problem. You want to know how to make your body ready to get back to being able to exercise again. And so in order to do that, you need to do these 5 steps. Okay? Step number one to solve this problem is a mindset shift. Okay? Instead of this mindset of no pain, no gain, we need to replace that mindset, that belief, with this push to it, not through it belief. Okay? We need to replace, number one, we need to replace the no pain, no gain mindset with the push to it, not through it mindset. So instead of constantly pushing ourselves through pain or into pain, we need to push up to the point of pain and not past that. We need to figure out what that point is and not push past that. Okay, so that's number one. Number two, the second step is to ditch the all or nothing mindset. Okay, culturally, we have this all or nothing mindset that limits us, because it says to us, if I can't work out 30 minutes, if I can't exercise, if I can't do the type of exercise that I define or that culture defines as exercise, then I'm not going to be able to do it at all. So we need to change that mindset so that we're able to do smaller steps that our body is capable of doing at the moment, so that we can actually work ourselves up to being able to get to the gym 30 minutes a day, 3 days a week. If you're not there, we need to step back and work on little baby steps to get up to that point, because it's not going to work by just forcing our body to do it. So number two, we have to ditch the all or nothing mindset. And number three is we need to gain an understanding of what's really going on in your body. You need to understand why you hurt on a neurologic level, like what is going on in the nervous system. What does your brain have to do with this problem? What does the spinal cord have to do with this problem? What do the nerves in your body have to do with this problem? How are they contributing to this problem? You have to understand those components in order for your brain to feel safer. Because like I said, the pain, part of the pain problem is the brain, for whatever reason, does not feel safe. And we need that brain to feel safe in order to reduce some of these symptoms of pain. Okay, so number three is really getting educated and gaining an understanding of really what's going on in your body from a nervous system perspective. Okay, number four, we need to weaken the pain pathways, as I was talking about. We need to weaken those pain pathways that have been well rehearsed and well practiced, and they're so hardwired together. We need to weaken those pain pathways. And the way that we do that is by preventing pain, preventing flare-ups, basically flare-up prevention strategies. And we also can do that by introducing or including pacing. And when it comes to pacing, there's a lot of, junk out there in terms of like how you can pace. And really you need a really simple strategy that's simple to apply on a daily basis for any activity, exercise, movement, position. You need to pace yourself in a way that's easy to use, doesn't make you feel like you can't do anything, And it's simple to apply and progress. Okay, so that's step number 4. We need to weaken those pain pathways by flare-up prevention and pacing, amongst other strategies as well, but those are probably the top 2. Okay, and number 5, we need to also retrain the sensitivity of the peripheral and central nervous system. Okay, there are various drills that we can do to address both sides. We have sensitivity in the peripheral nerves, the nerves in your body, and you have sensitivity in the brain and spinal cord, and we need to do specific drills that address each part of those problems from the top down. So by retraining the brain and addressing the issue in the central nervous system, and then from the bottom up as well, and addressing the sensitivity in the peripheral nerves in the body. Okay, so those are the 5 steps. Those are the 5 steps. We need to, I can go over them one more time. Number 1 is a mindset shift. Instead of no pain, no gain, we replace that with push to it, not through it. Number 2, we need to ditch the all or nothing mindset. Number 3, we need to get educated and gain an understanding of what's really going on in your body. And number 4, we need to weaken those pain pathways, make them weaker, by preventing flare-ups and preventing pain and using strategies including pacing. And number 5, we need to retrain the sensitivity in the peripheral nervous system and the central nervous system with very specific drills that address each one of those sides of the problem. Okay? And so the other thing is that, like, no one out there is talking about these things. No one is going to teach you how to do this. Not even your physical therapists, and especially not your doctors or your specialists. Okay? They don't have a clue. And that is why I'm going to be doing this live workshop next week called how to manage chronic pain naturally, or how to master chronic pain naturally. Gosh, I just forgot the title of it completely there. So next week on Tuesday, July 26th at 2 p.m. Central Time, I'm going to be doing this live free workshop, how to master your chronic pain naturally. And so there is a link to sign up in the description of this video. You can click that link to sign up. And anyone who attends the training, the workshop live, is going to get a copy of my chronic pain journal, which is a free tool that you'll be able to use right away to help you start focusing more on your pain management routines and your pain management strategies and healthy habits, rather than focusing so much on your pain. Okay, so definitely go sign up, save your spot, and I hope to see you there next week on Tuesday. And so that is all for now. That's all for today. Let me know in the comments if you found this topic helpful and what questions you have. Let me know your questions, because I am here to answer them. And so that's all I have to say for today. I will see you next time. Thank you.